Welcome to Life Found on Mars. The reason for the name of this seminar, Life Found on Mars, we came up with the title when we thought, well, you know, men are from Mars, women are from Venus, and we thought, well, okay, we found life in a man. This is how we came up with the title. So we're looking at current developments in the treatment and recovery from prostate cancer. Tonight, we are very, very fortunate to be here. I'd just like to, at the opening address, I want to just make a few thank yous. I want to thank the Prostate Cancer Foundation for supporting the event, as they always do. I'd like to thank a really big thank you to St George Leagues Club, who's provided this magnificent facilities and is really looking after us tonight. And a very big thank you to Coloplast, who's been responsible for the marketing, or a big chunk of our marketing budget, and for all of the refreshments tonight. So we couldn't have put on this event without the generosity of all of those parties. I think that deserves a round of applause. I'd also like to thank the staff and the speakers who have given freely of their time tonight. To give you some idea of the sacrifices that we've made to put this on tonight, Jo Milios is joining us. She's flown in from Perth to be with us here tonight. Professor Cozzi is a man who, you know, for every minute that he gives away, believe me, it's worth lots. So, you know, we're indebted to him. We're indebted to their teams, especially Annette Rich from Sanssouci Physio and her team. So the teams of each of these businesses have done so much to get you here tonight, you have no idea. I'd also like to thank my own team for all of the efforts they put in. It's usually at this part of my talk, and those of you who are here from St Vincent's tonight knows this to be true, that I always apologise right at the start. I will manage to offend at least several of you tonight, whether it'll be because this conversation is about sex, and religion, and erectile dysfunction. Like I come up with all the good ones, so I do apologise ahead of time. This talk actually is about sexual recovery in post-prostatectomy couples, looking at penile rehabilitation then, now and tomorrow. So I started off by going back to the past, and it became a bit biblical. So I'd just like to read for you that in the beginning, as far as penile rehabilitation and sexual recovery following prostate cancer and treatment were concerned, there was darkness. And God said to his chosen people, the urologists, tell your prostatectomy patients, let's wait up to 2 years and see what happens. And the urologists did. And the results were... And God said, okay, I admit, it's not my best work ever. And God spoke to the people of Pfizer and Eli Lilly and Bayer and said to them, create for me a tablet, create for me pumps and create for me injections that may help men in their greatest moments of need. And Pfizer, Eli Lilly and Bayer heard the word of God, and they created Viagra and Cialis and Levitra and Cavijet. And that is the day that Adam received the first Viagra pill. As you can see, Adam definitely was suffering from erectile dysfunction. Obviously, Professor Cozzi hadn't worked on him because it looks like there was major shrinkage there as well. And God said, this is much, much better. And the people that gave us Viagra, Cialis, Levitra and Cavijet danced and rejoiced. But the people still suffered. Depression, sexual dysfunction, and relationship problems continued. So, let's get serious here. With regards to penile rehabilitation and sexual recovery today, something like 50% of men who, prior to their prostatectomies, who said that they were functioning, they had, let's say, a normal range of erectile functioning for their age, something like 50% of men will not go on to take any form of post-prostatectomy treatment for erectile dysfunction. Of those that commence therapy, it's estimated that something like 75% will discontinue treatment within 18 months. So think about these stats. 50% of pre-functioning men go on to take no treatment. 75% of those remaining 50% quit treatment within 18 months. And when I started investigating this as part of my PhD research through Sydney University, these are some of the things that I discovered as far as the reasons why these statistics are as bad as they are. Started off with what I noticed were there were what we call fatal assumptions that were being made about the sexual recovery. And what we found is that fatal assumptions being made by urologists were things like either that sex isn't important to you or it won't be important to you in the future. As such, there's no point really talking about treatment that much. Or, the second fatal assumption I found was somehow you and your wife will somehow figure out how to do it for yourselves. With regards to the physicians that do attempt to address the issues, their focus is on what we call in sexual recovery and penile rehabilitation terms, a biomedical approach. So what we mean by biomedical approach is what they tend to do is they tend to prescribe the tablet. So when you've gone through your prostatectomy, what happens after the catheter's removed, you go for your first checkups. Usually they ask, how's your erectile functioning? And that to me always surprises me, because when they ask about how is your erectile functioning, I'm yet to hear one urologist ever go, you know what, this guy came in today and he goes, outstanding, it's better than it was before. Right? For most cases, the erectile functioning is going to be problematic. So when we look at this, the whole point is treating the condition with just medication. Now this is problematic because it fails to sufficiently address surgical outcomes, it fails to address what nerve damage occurred, the biomedical approach fails to address things like relationship quality and partner involvement in the recovery process. There's very little conversation or concern with regards to levels of sexual desire both in men and their partners. And as such, what ends up happening is that the treatment itself is massively incomplete. And what we have is we have a whole bunch of contributors that lead to post-prostatectomy erectile dysfunction. So some of these things are looking at things like pre-surgical health. If you were in poor health before your surgery, if you had poor erectile functioning, if you had cardiovascular disease, if you had diabetes, if you had health problems of any sort, these tend to be overlooked. If you're low as far as your libido is concerned, these things aren't taken into consideration. There's a whole bunch of factors there: sexual history, surgical outcomes, relationship quality and partner involvement. The relationship quality in itself is such a huge factor that it becomes overlooked. There's no consideration on it, or very little. It absolutely blows me away. One thing as a sexual health professional I know is this: if the marriage was in trouble before the prostatectomy doesn't do it any favours. So these are the sorts of things where if we fail to look at these, we're increasing the chances of post-prostatectomy erectile dysfunction beyond the damage that has occurred during normal surgical procedures, whether they be open or whether they be robotic. So men generally are using all forms of treatment for erectile dysfunction incorrectly. This is one of the big problems. Each of these treatments are frequently taken incorrectly. Tablets, vacuum pumps, and injection therapy. Let's just look at the tablet, for example. Now, by tablets, we're talking about things like Cialis, Levitra, and Viagra. Now, the thing that blows me away is with the vast majority of men who are prescribed these drugs, very few of them are ever told why they won't work, okay, or how to take them incorrectly. And there's probably about 20 ways you can actually take Viagra incorrectly. Now, most men are quite surprised to hear this. Most people think, well, I take the tablet, right, I have it with a glass of water, the penis fairy comes out, taps my penis, and lo and behold, my erection returns. Now, please put up your hand if you've actually witnessed the arrival of the penis fairy. None of you. All right, so let me tell you something. If you take Viagra, you can take the entire jar. If you do not have sexual desire, it will not work. If you do not have, if you have it after having a heavy fatty meal, it will not work. If you do not take it with enough time, it will not work. If you do not stimulate your organ, it will not work. And if you do not take the right strength, it will not work. And that applies for Cialis and Levitra. So with regards to these, what we find is that a lot of the time, men are getting medications, but they're not told how to take them correctly. As far as vacuum pumps are concerned, this is the most common thing that I find. Number one, in the hundreds and hundreds of men I've come across, and we've discussed vacuum pumps, even those who come to me with a vacuum pump, not one man have I met who actually knows how to use a vacuum pump correctly. Not one man has ever told me, with the exception of David, who's not a patient. But with regards to the vast majority of men, most of them, if I say, why have you been prescribed a vacuum pump? And most of them will say to me something along the lines of, it's to get blood in there. Okay, so true, it is to get blood in there, but principally the whole point about vacuum pumps is that it's meant to preserve penile length. All of you, I would imagine, or most of you, would have had nocturnal erections prior to your prostatectomy. And this was a form of housekeeping that the body goes through every night, 2, 3, 4 times, whatever amount. So when we're using vacuum therapy, what we're doing is we're trying to replace those. So we're trying to preserve penile length, because what happens is, if you don't have blood going into the organ, you get a build-up of scar tissue, we call this fibrosis, and you get permanent shrinkage. So these are some of the things. Injection therapy inevitably gets done wrong. Yes, we do get some instruction, but I have to say, in the last week, I have had 2 patients report to me, both separately, and this was a shock, they both broke the needle. Now, something is going seriously wrong. These are 2 men who do not know each other. So, what else are we doing wrong? Now, this is going to be a real complaint session, a bit of a whinge session, but I do have a hopeful message at the end. But here are some of the other things that are being done wrong. So, for example, men and their partners are being sent to sex shops to purchase substandard, non-medical grade vacuum pumps. Why? Because they are cheaper. Now, how many of you, ladies, tell me, when your husband said to you, we have to go to the sex shop, you yelled out, yippee. Please, tell me, put up your hands. Or prost, right? None of you. So, you know, they're being sent to these sex shops to get vacuum pumps because they're cheaper. I have a question, and the question is, when the doctor told you that you needed an operation, how many of you suggested that the surgeon should shop at Costco for the surgical equipment? Right? But we're being sent to go and get $50 devices from a sex shop. And when I tell people, listen, a surgical grade device, a medical grade device costs $400. And I hear, oh, $400, that's a lot of money. That's a lot of money. And I ask the question, how much did you spend on your prostatectomy? So, apart from receiving negligible advice as to treatment use for penile rehabilitation purposes, almost zero instruction is given as to how these treatments are to be used in a sexual setting. So, you know, this is a situation where partners are rarely or barely ever considered, even when they attend physician meetings. So why is this a problem? Well, it's a problem because this is a couple's condition. Okay, this is a couple's condition. Both are significantly affected by the condition, not just sexually, but in terms of overall quality of life. It's an interesting study that has come out in the last few years, which basically said the level of female sexual dysfunction actually increases as a result of the male sexual dysfunction that their partner has undergone as a result of prostate cancer treatment. There's marital breakdown, there's relationship breakdown, and in some cases we have depression occurring on both sides. Certainly there's massive increases in anxiety. And all these things cannot be fixed with a pill. So, getting back there, my opinion is what treatment should be included, and I'm thinking here that specialist instruction and advice should be mandatory. Every single patient should receive specialist advice as far as sexual recovery is concerned. Every single patient should receive advice as far as using treatments correctly is concerned. And if anything should be clear to you right now, no one does sexual recovery better than Italians. Right? Do we have any Italians here in the audience tonight? Right. Really? Okay. So we have some Italians here tonight. Let me just say, Dr. Cozzi, Italian, Lombroso, Italian, Milios, Greek, as close as we can get to Italian, and Annette Rich is actually Antoinetta Ricciosi, which is a very rare Irish brand of Italians. So let me tell you, the Italians do it well. So here's a study by some fantastic guys, Department of Urology in the University of Padua in Italy. Now, what happened with this particular study is that prior to surgery, all men were informed of a erectile dysfunction therapy that would occur, after surgery. So after the first session, all patients were shown an injection, self-injecting training procedure. So in other words, they get all the men and they say, this is how you self-inject, and they actually got the men to inject themselves. Okay? So all men received injections. Not a single person left without getting the injection. Now, why is this really good? It's great in one respect because what it's answering is what is one of the biggest problems to mankind, and that is fear of injections. So they overcame this straight away. Once you've jumped the hurdle, things are considerably easier afterwards. But think about it this way. How many of you, if you think about getting an injection, what happens? Your stress hormones go up. How many of you then think, okay, injection equals horniness? Right? It doesn't work that way. Right? So these guys, what they're doing was quite remarkable. Okay? After administering the injection, patients were asked to wait 5 to 10 minutes, and then their erections were evaluated. A positive response was defined as an erection sufficient for vaginal penetration. So what they then did is they basically looked at what was the response, and then they fine-tuned the treatment accordingly. Okay? This is a lot more, this is a lot better than just sending someone off to get some injections. Patients were instructed to use the injection therapy twice per week, and in addition to that, the doctors and the team took sexual histories and behaviours. So in other words, they looked at how frequently couples were having sex prior to surgery, how, the levels of satisfaction. They also looked at things like problems in regards to drug administration. So they pretty much covered everything. They looked at things like side effects, drug continuation, dropout reasons, lack of motivation, why men were stopping treatment. There was also a couples communication training which was used for handling relationship and sexual problems. So if the couple actually had problems prior to the prostatectomy, there was counselling for that couple. They also provided a telephone counselling service, so that if you were having problems, you didn't have to wait until your next appointment to come back to have those problems resolved or questions answered. And finally, one of the things that they did was they provided psychodynamic-oriented short-term sexual therapy. What does that mean? It basically means they offered sex therapy combined with sex psychology, which is pretty much what I do for a living. Okay? Now, this therapy was to look at what are the couple's sexual behaviours within the relationship. So it's not just how frequently they have sex, but what are her feelings towards sex? What are her feelings towards injection therapy? What are his feelings? So by looking at the manner in which they express their intimacy with each other, they were then able to tailor injection therapy to suit. Because recovery is not just about sex after prostate cancer, more importantly, treatment needs to embrace the idea of what I call sexiness after prostate cancer. So what I mean by sexiness after prostate cancer is looking at what is going on in the minds of the couple, and in particular the minds of the men. To fulfill this objective of sexiness after prostate cancer, what we basically are needing is if you think about it, what are men needing to feel sexy after having had prostate cancer? Well, for one thing, they need relief from performance anxiety. I see literally, hundreds of men each year who say to me things like, you know what, I want to be intimate with my partner. I want to just give her a cuddle. I want to be able to look after her. But they suffer from this performance anxiety, which isn't just related to erectile dysfunction, but there's a bunch of other things there. Like, for example, experiencing incontinence during sex, or having difficulties in achieving orgasm. What we want is a validation of their masculinity. So in other words, we're wanting there to be able to make a man feel like a man. Now often for a partner, they're often at a loss. What makes your man feel like a man? What are the things we need to do which gives them positive reinforcement, mental reinforcement, which makes them want to be passionate again, which makes them want to be vibrant, which makes them want to be intimate? These are the things that we need to answer. And also we need a sexual plan of action. So what we're looking at there is we're looking at, well, okay, we need to have a plan of how do you have sex after prostate cancer. You know, couples need also to learn how to incorporate treatments within sexual practices. So even like, for example, a vacuum pump. Now, it's funny, when I talk about vacuum therapy, all these women get very excited when I talk about vacuum therapy. And then when I explain it has nothing to do with a Dyson and cleaning up the house, they go, oh, it's that pump thing, isn't it? But understand, if we can take a vacuum, which we use for penile rehabilitation, and we can actually learn to eroticize the vacuum, and we can learn that a woman can actually use it on a partner and give him positive reinforcement and make him feel good about having that as part of their routine, then we're on our way to sexual recovery. Okay? So the interesting thing that came out of this study was that, remember what the stats that I gave you at the start? I said the stats were, 75% of men go on to no treatment. Sorry, 50% go on to no treatment, 75% quit within 18 months. In this particular study, there was a zero dropout. There was a zero dropout rate in this particular study. We had higher levels of sexual satisfaction as compared to the control group. Now what the control group basically is, it's the group which just got traditional treatment. Okay? There was higher levels of sexual satisfaction, high levels of sexual desire, orgasmic function, and relationship satisfaction. And the other thing that was interesting is that the sexual counselling, the psychological and sexual counselling that occurred was found to motivate couples to improve sexual intercourse and to correct mistakes in injection administration. Now, this study focused on intracavernous injections. But what I'm saying to you is, whether it is the use of PDE5s, Viagra, or pump therapy, or vibration therapy, which I'm going to talk about in a couple of minutes' time, by having counselling, by having instruction, we're less likely to have dropout. We're more likely to have high levels of sexual satisfaction. So this is all good if we can get urologists and general practitioners to issue a referral. Now, it's taken an eternity for physiotherapists to get those referrals. Now we're at the cold front of trying to get referrals for these matters. Now the interesting thing is, there's not a urologist out there who doesn't recognise that prostate cancer treatment leads to erectile dysfunction. But it seems to end there. Now I have to say, one of the things, the glowing praise that I had of Professor Cossey before, is this guy is a living exception to that rule. He cares about sexual recovery. The problem is most general practitioners, I don't think it's a situation that they don't care about it, but they don't even know this stuff exists. And in the 5 minutes, or they don't like talking about sex. So these are some of the problems. Men won't talk about it, and it's one of those things, if you don't know what you don't know. So I had a couple recently, late 60s, early 70s, prior to the prostatectomy. That couple made love 4 times a week, and I found that independently from both husband and wife. He was given no instruction, none. And you know how we cured, you know how his erectile dysfunction was successfully treated? 2 years later, after living as brother and sister, that was his wife's language. We lived like brother and sister. He met a guy on the golf course. And he said, we both had prostate cancer, and they got to talking. He goes, how's your stiffy? And the other guy goes, effing fantastic. And he goes, you're shooting me. He goes, tell me, what's going on? And he says, I use these injections. So the guy rings up his urologist, and he goes, have you heard of these injections? He goes, I heard about this guy, Dr. Such and Such, he does these injections. And the urologist goes, yeah, he's pretty good, I'll send you there. But nothing was mentioned for 2 years because of those fatal assumptions. I'm going to talk about a couple of things, just very quickly in the minutes that I've got left. There are new therapies that are out there. One of the therapies that exist is called penile vibratory stimulation. So where in the past the focus has been on filling up the penis with blood through either using PDE5s, the pills, or using things like the injections and so forth, now what they're doing is they're looking at using vibration therapy. This is called a Vibrect. Now women, this looks a lot like a hair iron. So when I say to men, you know, use your vibratory stimulation every night, do not do it in the bathroom. So I said, you know, if you accidentally have had too much to drink, I said, you know, you put 300 degrees Celsius on your penis. Not even Dr. Cosby's going to save you after that. Right? But basically, the way this works is it works on the bulb of the penis, where there's a huge concentration of nerves. And Joe mentioned earlier this idea of nitric oxide. By stimulating the nerves, it actually generates nitric oxide, and it reawakens the nerves that are in the cavernous nerves, which are the ones which were used in order to produce an erection. But what it's doing is it's also working predominantly on the pudendal nerves, which are the nerves on the top of the penis. And by using this nightly with erotic stimulation, both in a rehabilitation setting and in a setting of intimacy, what we're finding is that men are starting to experience improvements in their erections. What we're also finding in this, which is quite a remarkable device, you can actually see it at work there. I'm happy to talk to anyone about this afterwards. But what we're also finding as part of this is that men who haven't experienced orgasm in as much as 6 years are able now to achieve orgasm. Now that to me is a remarkable consequence of this amazing device. So penile vibratory stimulation is on its way. That's the next thing that's going to come. Finally, in the time that I've got left, and I'm way over time, but I'm the one who put most of this on, so... I talked about the research of the Italians, and they really ticked all of the boxes. The counselling, incorporating the partner within treatment, proper treatment instruction, and so on and so forth. So some of you have got this thing here. This is a registration for a Sex After Prostate Cancer workshop. I've decided, because of our cheapo friends who send people off to sex shops for $50 pumps, we are going to be putting on classes every Wednesday night, which will go through all of the treatments, how to use them for rehab, how to use them in a sexual environment, and we will answer questions. They will be 2-hour classes. Okay? They're going to be held in Surrey Hills. There's parking around the corner. This is our initiative. Okay? So we've kept, the numbers are going to be limited to 10 people at a time. Partners will be admitted free. Okay? So if anyone's interested in finding out more about that, please come and see me after this session.